On March 11, 2020, the World Health Organization officially declared the novel coronavirus disease, or COVID-19, a pandemic. From then on, governments imposed socially and economically impactful lockdowns, systematic shifts, and other administrative responses to mitigate the spread of the infection. Aggressive implementations of suppression strategies have already been implemented. However, this does not ensure that the spread of the coronavirus can be prevented, as the transmission will quickly rebound if interventions are relaxed. The World Health Organization has urged that COVID-19 can be resolved once the world has reached herd immunity, which can only be resolved by protecting the people with vaccination. Following this directive, government agencies are eager to claim that the pandemic will soon end with the approval and distribution of Food and Drugs Association approved vaccines such as Pfizer and Moderna. Thus, COVID-19 vaccines that can be used globally are the ultimate solution for ending the global pandemic. However, while these vaccinations and antiviral medicines are the most efficient means of preventing and treating viral illnesses such as COVID-19, the distribution of vaccines and antiviral medication is still a problem. For example, Serum Institute, the most prominent vaccine producer in the world, warned that not enough COVID-19 vaccines will be available for everyone until the end of 2024. Distribution to developing countries such as the Philippines and the country's rural and far-flung areas will only happen after several months, leaving these places still submerged in the pandemic's social and economic impacts. Furthermore, vaccination is only beneficial for disease prevention and added protection from virus exposure. Currently infected individuals would not be allowed to be inoculated with vaccines. Non-availability of drugs will prolong the recovery from these symptoms, resulting in untimely deaths in adverse cases. Hence, cases like this emphasize the need for a more immediate developed medication in the meantime. In this regard, herbal remedies, specifically those locally found in the Philippines, can be a helpful resource for immediate medicine or control schemes. Specifically, for those living in Albay and Camarines Sur, Bicol Region, Philippines, a catalog of plants and compounds with potential antiviral properties against SARS-CoV-2 can provide them with an information database of what to use as herbal remedies. Thus, this study assembles a comprehensive platform of in silico proposed potential SARS-CoV-2 inhibitor materia medica and compounds found in Camarines Sur and Albay, Bicol Region, Philippines, in tabulated or catalog form. In order to complete this study's main objective, the researchers conducted a 4-step filtering process, which is as follows. Number 1. Literature search for classified and studied COVID-19 antiviral compounds. In this step, related literature containing compounds that prove antiviral in the previous outbreaks, such as SARS-CoV-1 and MERS, were noted. Researchers also accounted for compounds previously used to treat COVID-19 symptoms, such as cough, fever, and the like. The resulting compounds for the listing were compared and cross-referenced in the databases PubMed, Dr. Jukes, and UPMTK-DLH to locate materia medica. Number 2. ADMET screening. The herbal plants and compounds scrutinized in this study are assumed to be taken orally by local consumers. Thus, the researchers used an in silico integrative pharmacokinetic model of absorption, distribution, metabolism, excretion, and toxicology, or ADMET, to filter out the compounds. ADMET screening is vital as it determines the compatibility of the movement of an administered compound with the physiology of the human body. ADMET indices that were investigated are cacao-2 permeability for absorption, volume distribution for distribution, half-life time for excretion, and rat oral acute toxicity for toxicology, with respective threshold values greater than -5.15 centimeters per second, 0.04 to 20 liters per kilogram, and greater than 0.5 hours, and in between 0 and 0.3. Those compounds whose ADMET indices fall within these threshold values are considered to have passed the ADMET screening process. Values of these four indices were obtained from the open resource ADMET Lab 2.0's database, and the canonical SMILES, which are required in ADMET Lab 2.0, were acquired from the free website PubChem. Number 3. Protein-ligand molecular docking. In order to execute protein-ligand molecular docking, preparation of ligand and protein structures was conducted. The 3D structure files in Protein Data Bank or PDB format of the three SARS-CoV-2 proteins, PLPro, 3CLPro, and spike proteins were obtained from the RCSB Protein Data Bank database. Meanwhile, the models of the ADMET-passed ligands and the structure data file or SDF format of the compounds were retrieved from the PubChem website before they were converted into PDB format through Discovery Studio. Autodoc 4.2 was used to prepare PDB-QT format files for target and ligand screening, and grid and docking parameter files. Blind molecular docking, which is a grid box large enough to cover the whole protein structure to encounter any possible protein-ligand interaction, was performed using Autodoc and Cygwin. And the last step of our 4-step filtering process is the plant selection and cataloging. Compound and plant selection was implemented through a series of sub-steps. Number 1, the filtered compounds were cross-referenced again to the UPM-TKDLH to find plant species that contain those screened compounds. And number 2, the plants tallied were re-evaluated to find the plant species that contain one or more antiviral compounds. And number 3, the filtered medicinal plants will then be tallied and organized in tabulated or catalog form. 42 compounds were accounted for after careful investigation of different related pieces of literature and cross-referencing among Dr. Jukes, UPM-TKDLH, and different studies, which were then filtered and used for further testing. These 42 compounds either have antiviral literature from previous viral outbreaks, have backed up studies indicating that they inhibit SARS-CoV-2, or are used by people to treat symptoms similar to COVID-19 symptoms. The table below shows the tallied 42 compounds and their respective plant sources, plant parts, and functions as researched. Out of the 42 compounds, ADMET screening shows that only 8 exhibit favorable movement across the human body. The 8 ADMET-passed compounds are as follows: allyl prop1 enyl disulfide, scutellarine, luteolin, aresolin, guvacin, guvasolin, homoaresolin, and caempferol. Only around 19% of the 42 compounds on the initial list are represented by these 8 compounds. The molecular docking of the 8 potential antiviral compounds from bicolana herbs reveals different binding interactions with the 3 target proteins of SARS-CoV-2. A compound's negative binding energy vis-a-vis these targeted proteins, according to the study of Du and colleagues, indicates that it can misalign viral processes all through an occurrence of a spontaneous binding. Thus, all 8 suggest a negative affinity value, indicating that all 8 compounds show promising antiviral activity against SARS-CoV-2. Furthermore, the binding energy's absolute value characterizes its binding strength or affinity. Simply put, the higher the negative value of the energy is, the greater is its binding strength. Hence, applying these principles, luteolin in particular, which incurred the highest negative binding energy value after being docked with 3-CPL-Pro with a value of -10, 0.01 kcal per mol, has shown the most promising inhibition results. Moreover, using Mukhtar's accepted cutoff, which qualifies compounds as antiviral significant if having ligand binding values less than the upper threshold, which is -6 kcal per mol, there will be 3 antiviral significant combinations from the current subjects, all of which were used against the protein 3CL-Pro. The compounds are as follows: scutellarine, caemferol, and leutellarine, with the latter having the highest negative value. To compile plants identified in Albay and Camarines-Sur, the 8 molecules that passed the prior selection processes were compared to our initial literature list and previously visited database. We found a total of 16 plants in the area that contained these compounds. The 16 plants found in Albay and Camarines-Sur that contain at least one of the SARS-CoV-2 inhibitor compounds are the following. Out of this 16 tallied, arecanut were revealed to constitute 4 or the most anti-SARS-CoV-2 compounds in this study. On a separate note, it was observed that the plants Appium graveolens or celery, Thymus vulgaris or thyme, Matricaria recutita or chamomile, Capsicum annuum or green pepper, Artemisia annua or sweet wormwood or damong Maria, and Allium sconoprasum or tarragon contain lutein, the compound with the highest negative value of binding energy, thus exhibiting the most SARS-CoV-2 inhibition. In conclusion, 16 plants locally found in Albay and Camarines-Sur were found to consist of 8 ADMET-passed compounds that exhibit potential antiviral activity against SARS-CoV-2. Although results from molecular docking studies are commendable in the development of research, researchers of this study recommend validating this study's findings with additional laboratory studies. Thermodynamic parameters such as MMPBSA or isothermal titration calorimetry, the golden standard of protein target binding estimation, may be used. The researchers also recognize the minimal inventory of UPM-TKDLH, which is still under its development phase. The vast extent of materia medica in Philippine locals requires a broadened library for the reference and advancements of studies similar to this. Aiding the development of antiviral research in the Philippines, the conduct of this study will cater to medical solutions to lessen the number of COVID-19 cases. Additionally, the input of knowledge about these traditional medicinal plant species will highlight the importance of ethnobotany, especially in far-flung areas where resources are under-researched. In the long run, the study, which supports the production of a drug based on locally found plants instead of importing a foreign drug, will aid the government in terms of appropriation, public health response, and scientific discovery. The discovery of potential antiviral compounds against SARS-CoV-2 will help curb the pandemic, ushering in a prospect of normality for communities.